Did you get your knee replaced thinking that it was going to give you all this mobility, you were going to be pain-free, but you still find yourself struggling? Your problem might be scar tissue. When I'm talking about scar tissue, I'm talking about that stiff feeling that you have around your knee where it feels like you can't fully bend as much as what you want to. It feels really stiff in the morning time or after sitting or when you're standing. Even if you reach that 120 degrees, you might find that it still is just a little bit too stiff and you wish you had a little bit more motion. This can help with that. Now, this is not a substitute for physical therapy, okay? So you need to go to physical therapy. But if you find though that you need a little bit more of a boost to kind of get you there, if it feels like you can't really hike and walk in the way that you want to and it just feels really stiff, I have found that these 4 techniques make such a big difference. First, we're gonna go over muscle scraping. And then we're gonna do 3 different stretches. Okay, so that's 4 things. Now, the thing is that before you do anything like this, you had surgery. You should consult with your surgeon and with your PT, okay? I'm not a substitute for that. Now, I help my patients, right? But this is just advice on the internet, okay? So you need to then also make sure that you're doing what's right for you. So consult with someone first, okay? What you will need, a muscle scraper, you'll need a chair, and then steps. You can do the last one with a chair. So at least at a minimum, you need a muscle scraper and a chair. Let's get started. I went through a whole video of what to do for muscle scraping, but this one's gonna be targeted just for the knee. If you wanna see the whole video in terms of muscle scraping and breaking up scar tissue and just my favorite muscle scraping routine, we're gonna attach the 2 videos below. Okay, so first we're gonna start with the incision. Now, you can go about doing all of these things in a few different ways. You can have your knee bent or you can have your knee straight. When your knee's straight, you're gonna get to more superficial tissue versus when your knee is bent, you're gonna get to some of that deeper tissue, and this is a little bit more taut, so you're going to feel it a little bit differently. So you're going to go through this whole area for a minute, okay? So you're going to kind of come along the side, through this adductor, through your quad, through that IT band, and you want to get through this whole area, even all the way up into this like top part of where the hip is, because all of those muscles go the whole way through there. You can target that scar itself by having that knee in a slight knee bend can be helpful to get to that scar. And the scar kind of needs about a minute itself. You can kind of get to some of that end range and go all the way through there as well. So now you want to do a total of 3 to 4 minutes through this area, and you want to get the whole area. So even if one area hurts, you want to make sure that you address the whole thing, because working on one part is going to help with decreasing the amount that the whole area is tugging. So now again, this isn't all scarred necessarily. You have muscles, connective tissue. Yes, you do have the scar, but it's all of this area in through here. There's a lot of connective tissue and a lot of muscles that come through here. So that's what can make it feel stiff when you're trying to finish bending that knee. Let's move on to the stretches. The first 2, you will need a chair. So this seated knee flexion stretch is pretty well known. So you're gonna start with, first your heel is going to be on the ground, and then what you're gonna do is you're going to just try to scoot yourself forward just like this. You're gonna hold for 5 seconds, and then you're going to come back. You're going to repeat that 10 times, okay? And you want to do somewhere between 3 to 5 sets of that. Start off with 3 sets though, just because it might be pretty intense to start. But then each time what you're doing is you're trying to get a little bit further. Now watch out for this hip, because this hip is going to hike in order to avoid the stretch. The next one is one of my most favorite stretches. So you'll need a chair. You want your ankle hanging off the edge of the chair. And what you're gonna do is you're gonna try to squat down. So you're gonna try to bend that knee as much as you can, hold for just a second and come up. And you're gonna do that 10 times. So each time you're gonna try to get just a little bit lower. Then on the last one, then you're gonna hold for a little bit longer, just a little bit longer. You're gonna find that that hip's gonna hike up, try to push that down. And then you're going to repeat that for 3 sets. Last one is a step stretch. You're going to put your foot on maybe the second step or so, put your hands on the railing, and then you're just going to lean forward and come back. Now remember though, this movement isn't just coming from my knee, it's also coming from my hip. So what I like to say is push your hip down and then come forward. That's where actually being on a slightly higher step can really help you to get a little deeper. Let's see what that looks like. So being on that slightly higher step will get that hip to kind of come down a little bit, and then you can kind of really focus on getting that end range of motion. You're gonna do 10 repetitions back and forth for 3 sets. And remember, on that last one, on that 10th one, you're just gonna hold a little bit longer, okay? Now, with any of these stretches, you can also add in that muscle scraping. So you can be here on your steps, and then you can do that scraping. Make sure though that you can balance though when you do this. With the knee flexion stretch, you can hold here and then scrape all the way through there. And with the seated knee flexion stretch, once you get to that end range, then you can do the muscle scraping all the way through. For the seated knee flexion stretch, you're gonna hold for 10 to 30 seconds, and you're gonna do that 3 to 5 times. For the squat stretch on the chair, do 5 to 10 of the little repetitions of getting a little bit more knee flexion, and then in the last one, you're gonna hold for 5 to 10 seconds, and do that for 3 rounds. For the squat stair stretch, you're going to do 5 to 10 repetitions of bending the knee, coming out of it, bending the knee, coming out of it. And you're going to do that for 3 rounds. So for these 4 exercises, remember, consistency is key. So this is the kind of thing that benefits from time and consistency. So you really do need about 4 to 6 weeks or so to really feel a huge change. And you're like, why would I ever do that for 4 to 6 weeks? Do I know if it's even working? You're gonna feel more loose after each session. But the thing though is that when you get that measurable change that lasts for an extended period of time is once you've been consistent for 4 to 6 weeks. Don't do this more than once a day, but if you can do this 4 to 7 times in a week, it is going to make a huge difference. Now, remember, more is not necessarily better. The right amount is what's right, okay? So err on the side of a little bit less, right? So I had you guys doing 3 sets or so. You might even find that 1 or 2 sets is sufficient. That's okay. Each person is a little bit different. Then you can start to work yourself up to it. This is supposed to be one of those things where we're just edging forward a little bit in terms of making progress. We're just trying to make little incremental changes. We're taking these little baby steps, right? We're not running off a cliff, okay? So it's like we need to go piece by piece, and that's what's really going to make the change, because the consistency is what matters, not doing a ton in one period of time, or that then you get so sore that then you're like, Chloe, I do not want to do this for another week, right? I'd so much rather have you be able to tolerate doing it every other day than work up to doing it every day as a way of progressively challenging that flexibility. This is the sort of thing that we need, this just little bits, and that's what's going to make a big change, not a lot of effort once. If you guys have any questions, feel free to ask. Remember, I can't necessarily give you advice exactly about you. You're not my patient. What I can kind of do though is kind of point you in the right direction. This is not a substitute though for seeking care, right? So talk to your surgeon, talk to your PT about some of your individual needs. This is intended to be guidelines. I'm sure that you know someone who is struggling with that stiffness in the knee, so share this video with them because I'm sure that they'll benefit from it. Make sure to like and share and subscribe to our YouTube.